sometimes it's helpful to explore where those origins came from, and that maybe that might motivate or influence what a patient wants to do next. And we will certainly talk more about values in the latter part of today, but a good guidepost can be, behavior change is hard. Anything we do in psychotherapy is hard, right? But changing behaviors is really difficult. And so finding motivation can sometimes come by thinking about our values. So we can help our patients assess, what are the behaviors or actions they're engaging in that would be inconsistent with their values. Those are often the situations that our patients are feeling shameful about, or that they're feeling stuck or confused about. And as we help them reroute, we ask, well, what values are most important to you, right? What actions related to those values would you like to commit to? Again, we'll talk more about it, but one of our participants shared that she's an eating disorder specialist, right? And does a lot of ACT, right? That it makes perfect sense and it can be problematic, but that we can really communicate that empathy. And again, and that attitude, if anyone participated in last month's experiential webinar, Ed does a really nice job of talking about attitudes as part of an experiential practice. And I think that lends itself very beautifully here, that what we are trying to help our patients practice is putting that attitude on themselves. How can they just be curious about their own processes? Rather than a stance of judgment and criticism, right? That we can just model this compassion and a trying to be attitude, right? Of not just being passive and feeling helpless and not feeling judgmental and critical, but instead of, yeah, when that person does say that, measurable, attainable, realistic, and time bound, but really concrete and specific is what we're going for. And that we can model change as an experiment, right? And just noting, it's not that you have to do this. And we're not even saying that if you make this change, all these things will definitely happen. We're just saying, hey, let's try it out, test it out, and see what we learned. That's really the collaborative empiricism that a lot of us have grounding in. And then in my experience, I think really lends us to nice collaborators with our patients and really helps us be with them rather than separate. And in this context, I know Jeff said we're not going to, expound on skills deficits so much, but we can see that skills deficits could fit in here, right? That a skills deficit might be helpful to address to increase the likelihood of success when needed. And step number 7, making intentional choices about
discovering more effective actions, making intentional choices. Great. Great rapport between the two of you. Victoria saw great empathy. Sue-Ann said discovering more effective actions, making intentional choices about which actions to maintain, modify, or accept. Jolanda said supporting effective behaviors that are already occurring. And Michael said all of them. So good. Again, Jolanda also said I would also say making intentional choices. So a good representation of these skills. So let's move on to the next part.
Okay, final part of these. Foundational skills, level 3, enacting adaptation outside of therapy. Uh-oh, Jeff, we lost the slide.
I know.
There we go.
Is it back? Oh.
It is. Now you just have to find the right page.
Okay.
Okay.
Sorry,
perfect.
I pressed the wrong button.
No worries. Okay, so let's jump ahead.